I now am calling upon Dr. Ajay Durrani. He will be speaking on a study of correlation between severity of CSCR and severity of association psychiatric disorders.
Thank you very much. So this is a study which I'm ongoing since long time. So we know what is CSR. It's an idiopathic neurosensory retinal detachment, affects young males commonly. In type A personality, corticosteroid use and psychosocial disorders like depression and anxiety is seen in these patients. And the treatment, we know it's usually a self-resolving condition. It requires laser or PDT in most of the cases. This was our study which was published, in which we did a psychiatric evaluation of patients with CSR in Asian Indians, and we found that, in these treatment-naive CSR patients, almost 77% had mixed anxiety disorders, 12 had adjustment disorders, and the rest had major depressive disorders. So this was a prospective double-blind trial which we had done. So after that, we took this to the next level, and we thought that they were treated with anxiolytics by the psychiatrist, and we found that the resolution with either etizolam or acetoplarazam, which is a SSRI inhibitor, led to a rapid resolution of the fluid. Normally, the fluid resolves in about 2 to 3 months, and we had a resolution almost a month in these patients. So this is the hypothesis which was initially proven by, was discussed by Januzzi, that stress leads to increased glucocorticosteroids, which leads to CSR. And so the young population, typically the type A personality, and there's increased norepinephrine and sympathetic response, which leads to a pachychoroid also, and that's why PDT works in these patients. So this is the basic etiopathogenesis which was discussed by Januzzi et al. And the other theory is the vortex when increased congestion. So this was a study of the correlation of the severity of CSR and the severity of the associated psychiatric disorder. This is the second part of the first study which we published. So this we did the study of the socioeconomic profile of the patients and their DAS scores. The DAS score compares the anxiety, stress, and depression score which is done. It's a sort of a questionnaire which we give to the 33 patients which we had, and we had 33 controls in this. Over 2 years, we did this in young patients who presented to the OPD with CSR. After thorough examination and FFA OCT, a DAS scoring was done, which is you give a questionnaire to the patient and he responds to that, saying whether it was discovered by Lovibond et al. In 1995. There is 3 self-reporting scales of depression, anxiety, and stress. And they can again be classified into the gradations, from 0 to 3. So the patient will decide, depending on how he feels. It's a personalized sort of a questionnaire which we give to the patients. So the results which we had in this group of patients, which we saw that the most affected was the socioeconomic upper lower class, means like not the totally lower class, the middle class, what you can say, the middle class of the patients who were economically not very bad off. The acute cases in younger age group, while chronic cases were more seen in the elder age group. Psychiatric morbidity was significantly associated, almost 60% of the patients with a P significant value, and a higher score of DAS significantly with a larger area of associated detachment which we saw. So this is a graph which is showing you the CSR patients are in blue and the controls are in brown. So you can see that the severity of the psychiatric disorder was seen more in the patients with the CSR group. And the area of the CSR subretinal fluid also was associated with the severity of the psychiatric morbidity which was seen. These are the different sizes of the fluid, small, medium, and large. So this is the detailed psychiatric evaluation also was done as a follow-up of this after the DAS study. And this was the basic detailed diagnosis which was done. So the psychiatric OPD was also blind to what the patients had. They were just sent for this. So this is few of my cases which I want to show you, which showed a rapid response after treatment by the psychiatrist with anxiolytic drugs, and the rapid resolution of these cases. This is the second case. And normally we get resolution, like this patient had extensive subretinal fibrin, as you can see, but there is flattening. It's not that all patients resolved. Some of the patients did require PDT in chronic cases of CSR. And here you can again see that there is even, resolution of fluid after some time with these patients having constant therapy with anxiolytics. This is a patient, again, a 40-year-old man with CSCR with pachychoroid disorder, and he's remained flat with anxiolytics. But some patients don't necessarily flatten totally, and there's always a shallow, irregular retinal pigment epithelial detachment. Sometimes it's seen in these patients. This is another patient showing a very good response. but they do have recurrence. So this underlying psychiatric disorder may be one of the reasons why these patients are so prone to develop CSCR. So the conclusion which I laid in my this study, which the first paper and the second paper with the DAS study, is that stress is relatively common among these young patients. The severity of the CSR and the area of neurosensory detachment was correlating well. Sorry. We require definitely a larger sample size to have more, rather than, this is just a hypothesis which we have said, and we have tried it out in various patients and have had good results, but we should have a better sample size. And you can go on to DAS 41 score is also there, which is a more complex, nomogram where you can study yourself sort of. Thank you very much for your patient hearing.
Thank you very much for your nice presentation. But my question is, only anxiolytic, or do you need some epinephrine-like drugs?
Yeah, so actually, sir, what the epinephrine drug also is like a anti-mineralocorticoid drug,
Yeah.
So here we are thinking that the corticosteroids are the main driver, as I showed you, the stress leads to this. So these anxiolytic drugs are working to reduce the glucocorticoid level.
Yeah.
Because it increases noradrenaline also is what has been shown in these patients, due to the high stress levels. So I have not done epinephrine in my patients, sir. They've only received anxiolytics, which maybe is
Only
working
anxiolytics.
yeah, which
Okay.
is maybe working on the glucocorticoid pathway is what the hypothesis is. But the sample size is small, I think,
Yeah.
But clinical experience has shown very gratifying results, because in acute CSR, we don't have any treatment to these patients,
Yeah.
So this is one thing which we have done clinically also.
We've done everything empirically.
Yes, sir, yes.
Yeah.
But this, sorry, yeah.
Actually, with the DAS score,
Yes.
can you tell a patient is psychiatric?
Yeah, so no, that's what, so we didn't want to.
If I get a CSR tomorrow before going to the OT, I will get damn stressed and my DAS score will be 25 or
20, yeah, right. No, so what we did, so this was the second part of the study. The first part, as I showed you all, we had referred this patient as a double-blind trial to the psychiatrists. And after that, we decided to compare that whether the severity of the CSR correlates to the severity of the stress. Like, you can have either anxiety, or you can have depression, or you can have stress, the 3 gradation. So this DAS score is quite a intensive score, which has...
They should be followed up with the psychiatrist, and then after it resolves...
Actually what, we did the DAS score, and then we sent them to the psychiatrist also, and they started the anxiolytics in this study also, the response.
Okay.
I didn't start. But in my private practice, after this study, I'm giving my patients at least a mild anxiolytic when they present to me.
Stress is causing CSR or CSR is causing stress?
So it's a vicious circle. So I've seen that initially a stress will precipitate CSR, and then later on a chronic CSR becomes the major stress in his life, because his as has some monetary problems, and then the vision loss is becoming a secondary problem. So I think it's a vicious circle which you can break with this drug.
Thank you, sir.
Thank
It's
you,
a very
thank you.
good presentation.
Thank you.
Now I call upon Dr. Chirag
So it will
AB.
be economically viable if we use the anxiolytics.
Yeah, it is.
वो जो
Yeah, we didn't do that study actually of measuring the glucocorticoid levels, but that has been done in various studies.
Okay.
They have been utterly published that there is a higher level of glucocorticoids in these patients, levels in these patients with CSCR.
So psychiatrist हमारा patient नहीं खा जाएगा.
So that's what. So this was. I want to tell you this was. No, this was done in a tertiary medical college.
Yeah.
So we have a ophthalm OPD and a psychiatry OPD just nearby. So it was done in a medical college.
Yeah.
In private, I'm not doing it, frankly, to tell you, sir.
Actually, there is no evidence, actually even mild evidence for anxiolytics in CSCR. You take the evidence-based medicine.
I totally agree with you. I totally agree with you. So that, what got me thinking is the Lawrence Yanuzzi's article. If you read, there is an article which he has said. So that's why I took it to the next level, and we found results, in my clinical patients, clinically. So.
Require more cases.
Yes, I definitely require more cases. Yes, sir. Yes, sir. Thanks.
Thank you very much.
Thank